being recorded for the purposes of distribution to a broader audience so that folks can go back and view mitigation videos at their leisure. I'll show you where to find these videos during the agenda today. Coming up every week for the next 3 weeks, and perhaps even more, we're going to be doing vaccines for schools. So we're just going to be covering that topic every week for the next couple of weeks. I've got some of the vaccine experts over here, the subject matter experts from the health department on the call. They'll continually be invited, and if they can make it, then they will be on the call. If they can't make it, then I will make sure to get any relevant information that's needed for folks on this call as it pertains to vaccinations. I also know that there's been a lot of discussion and a need for updates on CLIA and Binax and testing in general for schools. So we will make space for that on future agendas as well. Just know that I'm undergoing some professional development in relation to those topics. Currently, I'm not a subject matter expert on those topics at this point, and I don't want to give any misinformation. So as soon as I'm able to get enough information about those topics, then we'll start passing out that contextually to you on this call as well. Just a reminder to please use the chat box as questions come up, and we will go back and address those. If you've got an iPhone or something where it's just a really small keyboard and it's easier, you can go ahead and use the raise your hand function, and we'll make sure to address questions as they come up today. So first thing on the list is vaccines for schools and where we're at with that. As a brief update, I have Kristen Robinson Lund and Crystal Rambow from the Pima County Health Department, who are in charge of vaccines and vaccinations in general. Currently, we're in the 1A group. We are definitely preparing for 1A distribution to school nurses. And if you haven't already, please get me the number of nurses within your district that are eligible for 1A vaccinations. Crystal and Kristen, if maybe you can go into a little bit more detail of what that entails, the definition of school employees that meet 1A, and then we can jump into 1B right after that.
Hi, Brian, it's Crystal. So as far as who's going to qualify for 1A at this point, it would be dedicated school health staff. So of course that's going to be your school nurses and your school health aides, or whatever title your district applies for those individuals. Those are the people we're really looking to get vaccinated for 1A.
Awesome, thank you, Crystal. So I know we've gotten some questions about athletic medical athletic professionals, folks in occupational therapy and physical therapy, speech, things of that nature. Currently, those individuals do not meet the definition of 1A, so they will all be eligible for 1B if and when we start the deployment within those subgroups. So that's the next part on this for the vaccine discussion, is 1B in general. So for the 1B group, and Ms. Prather, I'll jump back on your question here in a second. For the 1B group, we don't have a solid date at this point in time, but Crystal or Kristen, if you can maybe comment a little bit on where we're at with 1B. I'll talk a little bit about what we need from you all in order to move forward with that, because we are trying to put the pieces together for that rather quickly.
So did you just want a general overview of where we're at for 1B timeline-wise and planning?
Yeah. Thanks, Crystal. Sorry for being very murky with my clarification.
No, I just want to make sure I'm telling you guys what you want to hear. So for 1B, we still don't know exactly when 1B will commence. What we've been kind of indicating is that we think 1A will take at least another month to complete, but there are a lot of unknown variables there, as we've kind of been saying. What we're really working on for 1B is expanding our provider network and identifying additional vaccine partners, because we know that 1B is a much, much larger group and much more dispersed, because 1A was quite a bit smaller and more contained. So we really need to put vaccine in to additional provider hands so that it can get distributed more quickly. So we have lots of teams working on lots of different partnerships to hopefully provide good individualized service to everybody that's in those individual groups in that 1B section. So that's really what we're working on right now.
Awesome. Thank you, Crystal. Quick question from Miss Prather here, two in a row. Regarding 1A, Pima JTED employs RNs, LPNs, not serving as school nurses, but are training nursing assistants. Do they still count in the 1A group?
Yes, so in the 1A group, it's all healthcare workers, so they would still be able to be vaccinated as part of the 1A group.
Cool. And then for 1B, who is included? Anyone who is employed in a public school is covered under 1B, and I do believe that even covers governing board members within a district as well. Crystal, do you have comments on that?
I would agree with that. Yeah, I think it's going to be all education-related staff.
Okay, so anyone that is, and substitutes even are included in that as well, Dr. Streeter. So this includes your food services, your transportation, governing board, your legal team, anyone who serves to assist in your district as a functioning entity or your organization as a functioning entity. They are qualified for that 1B group. And Crystal, just to make sure that I'm not misspeaking, if you can just validate that.
Yes, that is exactly right. So substitutes definitely are included, and all the groups that Brian mentioned, yes, are also going to be included in that 1B group.
Awesome. Thank you, Crystal. So a couple of quick things that I really need this group to get to me as soon as possible. I absolutely will need the 1A totals, which will just, again, as Crystal stated, be your functioning school nurses and health aides within your schools. I need to get those numbers. If you can get them to me by close of business today, and I know that's kind of short notice, that would be ideal. For 1B, you can take a little bit more time around that because that list is going to be far more comprehensive. Your 1B total, we just need the number of the all employees underneath your district's purview. If you have like JTED might have some crossover between employees. So go ahead and Ms. Prather, go ahead and count all of your employees and send that total over to me. If we go over estimate by 100, 200 vaccination counts, I think we're okay with that. I'd rather overestimate than not capture individuals in terms of the finalized number that we send out to our logistics to say this is how many we need to prepare vaccinations for. So get the 1A group to me. That should be maybe 11, 12. TUSD is the one exception. Nikki and Penny, I'm assuming that you've got a list of all the nurses and health aides, that just a number of how many exist within TUSD as a district. I'm guessing it's probably going to be at about 100 in total for that district. Other districts, I've seen anywhere from 9, 11, 15, those kind of numbers for the 1A eligible vaccination group. Okay, any questions on that particular piece at this point in time, the 1A specifically? Okay, so what we're going to do on our end is as soon as I hear from the vaccine team that 1A is open for school nursing, we will do a blast out to all of you. We'll be working with Superintendent Williams's office to make sure we try to get this communication out through multiple methods. So you may get 15 emails from us saying 1A nurses are ready to go. At that point in time, we'd ask for your assistance in communicating to your school nurses and health aides that they report to either TMC or Banner. If we have more direct instruction on that, we'll provide that to you as well so that they can receive their vaccinations. We just need the raw number for the 1A list, although if you have the names, that is also helpful because I am trying to document all of that as well. So if whatever you can get to me before 5 o'clock today, totally down with that. So Crystal, if you can address Dr. Hagerman's question, current draft timeline for 1B is last week of January, first week of February. I'm believing that's a little optimistic.
You know, I think that is it is a little bit optimistic. I don't think it's completely unrealistic either, but I just think we need to be really cautious about assigning particular deadlines like that, or not even deadlines, but even just timelines, because there's a lot of unknowns. Um, I mean, I'm saying that I think it'll be at least a month, so that could be the last week of January-ish. So I think it could be somewhere around that time, but we're just really not sure yet.
Yeah, thank you. So again, please email those totals to me directly, brian.eller@pima.gov. I will be looping in the superintendent's office. Dustin Williams's office has been very agreeable in terms of making sure that we get all these numbers accumulated out and cross-checked, cross-referenced, and that we get all that information off to logistics as soon as possible. So just go ahead, send those numbers to me. I'll share those with Superintendent Williams' office, and we'll begin to submit those numbers over to logistics for planning purposes at this point in time. I do want to also say that there have been a couple of districts that have expressed interest in being points of suspension for vaccinations as well. I'm going to be very candid with you. The logistics behind that are incredibly challenging and difficult. We will be more than happy to work with you if that's something you're interested in doing. We think that it's going to be really efficient if we do have multiple points of suspension spread across the county. So if we have one or two districts partner together to work as a singular point of dispersion for 2-3 school districts, we think that that might be a really effective method of vaccinating our school employee population in a very timely manner. Things that you'll have to consider logistics-wise will be things like who's actually going to administer the vaccine. Nursing staff is incredibly high demand right now. Most nurses are working in hospitals or long-term care facilities as a whole. So actually getting the folks to administer the vaccination is a real challenge. If you have alumni networks that you can turn to that are willing to serve as vaccinators that have the credentials necessary to do so, if you have school nurses that are able to administer those vaccinations as well, those are other viable methods for doing that. And if you're interested in your district as being a point of suspension for the vaccines, reach out to me directly through whoever your established point of contact is at your district. And then we'll try to work with you so that you really do get a deep understanding of what those logistics entail and what all of it means, because it is a very, very big lift. And I can also add that the financial support from the county is not currently in place for that. The vaccinations will be free and the shots will be free, and we can provide that to you. But there's a lot of other things that go into it. Crystal or Kristen, do you want to add anything else into that?
Brian, I just would like to offer my help. This is Kristen. If they are interested in onboarding as a vaccine provider, I can help with that piece. And then also connect them with the third-party biller to bill for administrative fees. That might help offset some of those costs. So those are some things to think about that can be helpful for you guys. And then also we put together some training information that you can use to train your staff on vaccinating and all the storage and handling requirements. So those are all available to you as well.
Yeah, thank you, Kristen. And we have had 2 partners so far from the community that have been willing to at least begin investigation into this as a potential site. So if you're interested in doing that, go ahead and email me directly. I will CC you back with Kristen's email. We'll set up some time to go over all of those details, and we've been able to do that in a 30-minute Teams meeting and go through most of the details of what needs to be considered with that. And we will definitely serve in an advisory capacity and a technical assistance capacity with districts that are interested in administering vaccinations. All right, couple of other quick things we're going to cover here. CDC quarantine guidance. We have this new reduced quarantine graphic. I'm going to drop this in the chat really quick so you all have access to it. And then I'll pull it up and show you what it looks like. This again was done by Jessica Martinez, our U of A intern, who's been doing some really great work for us in terms of the graphic communications. So here you can see that in terms of the shortened quarantine time period, either 10 days or 7 days, with 10 days, it can end with without testing if no symptoms have been reported. That is, however, in consideration that the individual has been masking with fidelity and that there's been a lot of mitigation that's been followed. Then they're eligible for this 10-day quarantine period. The day of exposure is day 0. The first day after that would be day 1 of the quarantine. I know that there's been it's been difficult to communicate this clearly. So this particular format, I think, is very helpful in communicating out what that quarantine timeline actually looks like. You could see just underneath that, the timeline for the 7-day release, which means that the student or the staff member would return on day 8, pending the test results on day 5. Negative test results and no symptoms presenting during that time period as well. Okay, we have this in English and Spanish, so you can all print this out. You can share it on social media. You can do whatever you need to get this information into the hands of the folks within your communities that need it. So on the agenda is local legislation. I'm just going to briefly show this page again. This is the correspondence and memorandum to the Board of Supervisors. Important things to look at on this, and I'm not going to take time to go over this today. I'll just trust that if you want to look at it, you can peruse it at your own time and leisure. The Public Health Advisory Update on COVID-19 is a important document to review. The COVID-19 positive cases among employees, that's purely just for Pima County staff in general, but I think it does give there's some other useful information in there that you may have, you may find some helpful answers in terms of some of the experiences that you all may be having within your school districts as it pertains to policy, things of that nature. There's also some other information about the voluntary curfew, observations related to that, and CARES funds allocated for business assistance grants, if those are things that you need to be aware of for community support functions within your relative districts. Quick question here from Nikki Stefan. TUSD fill out the internet interest form on PCHC site. However, we're not on the agency list yet. Do you also want our health staff numbers? And Nikki, I do have that question for you. I was preparing for this webinar. So after this today, I'll give you a call and we'll go over to make sure that I'm addressing all of that, the questions that you listed out to us on that email. So thanks for that, and I apologize for the delay in that answer. Close contacts are cumulative over 24 hours. Please remember that that's 15 minutes of exposure within a 24-hour cumulative period. That's incorrectly stated. 15 minutes cumulative over a 24-hour period. That's a correct way to say it. The who to list on here is a critical piece. Okay, so we've seen a lot of forms recently that have been submitted with brother, sister, mother, father, grandparent, neighbor, individuals like that. In terms of the schools reporting, all we want to see is just students or staff within your school systems that have had close contact who have been exposed to the individual case. The case themselves, okay? So it's just the individuals connected to your school system that we would need to see on that close contacts Qualtrics report. So please take note of that and share that out with the individuals who are conducting the reporting on behalf of your relative agencies. Arizona dashboard metrics. I think everyone on this call is familiar with these and where we're at currently. So you all know how to find this. You know where these metrics are at. We're currently at 18.9% positivity. We're down to 13.2 in hospital visits for COVID-like illness in the region, but we're still in the red consecutively for a period of 2 weeks. So that's important information to know. Outbreaks. Schools, we're currently at 31 outbreaks in total since August. We had a high of 7 outbreaks about 3 weeks ago, but things seem to have kind of smoothed out since then. Another quick question from Ms. Whitesides here. If they have a sibling who's also a student at our school or a sister school within the district, yes, we would definitely want to know about those individuals because they would be connected to your school or to your district, Ms. Whitesides. So if they're outside of the school or outside of the district, then don't worry about reporting in that case. Another reminder, the 1A and 1B totals, please get them to me. 1A specifically before 5 o'clock today, if that's possible. 1B by close of business Friday next week, if you're able to do that. If you need more time or if you need more information on how to collect that data, then feel free to reach out to me. I can help kind of guide through that as best as I'm able. The YouTube channel. So this is linked on the agenda. We've had some issues with our communications being able to upload these videos to the website because of the amount of bandwidth and storage space that it takes up. So I went ahead and this is not an official Pima County website. I want to stress that this is not an official Pima County website. It is my personal channel that I set up to just put videos on here so we can get these out as a resource to folks in the community. So it's up here, it's accessible. The video from today will be posted up here as well. I apologize for the delay in getting this to happen. We had to do some creative thinking about how we should have done this earlier. And frankly, if I would have consulted with my 11-year-old earlier, they could have probably told me, why don't you just post it on YouTube? And this issue wouldn't have come up for such a long period of time. So that's there, that's available. I do want to just give a brief preview for a document that we are working on right now. What you're looking at here is the overall age 5 to 18 of COVID, confirmed positive COVID case. This was as of December 23rd, 2020. So we will update this with the entirety of December. You can see though that ages 5 significantly less than even 14, 15, 16. We think that this data alongside with other emerging research and data that's coming out is evidence enough for a staggered return to education, and that elementary, specifically K through 6, is safer for a return to hybrid learning and even in-person instruction than middle and high school at this point in time. When looking at and this is all data from Pima County specifically, according to our MedSys ELR lab reports. So we could see from ages 5 to 11, the cumulative caseload is 32%, whereas ages 12 to 18, again, this is for the 5 to 18 age range, is up to about 68%. The mitigation that's being utilized within these settings, other measures to reduce spread in the community are all things that we're working on, making sure we have the appropriate citations before we send all this out. But we are going to be doing a recommended phased or staggered return to learning. And if your district, I know some of your districts are already planning on returning on the 4th for elementary. We think that that's something we can support at this point in time. As soon as this is done, we will get this information out to all of you, and hopefully it will be helpful and serve the needs of your communities that you interact with. That concludes the agenda for today. I knew I kind of flew through that, but at this point we're going to open up for questions, comments, concerns, things of that nature. So you can feel free again to post those in the chat, or you can unmute and verbally ask questions. I do want to just give a big thank you to Crystal and Kristen. Those folks are super busy right now, and to be able to take a couple minutes to sit in and just provide this update for you all, I think is really helpful. As they do that in the future, they will be on the top of the agenda if they're able to attend. We're just going to give them the first 15 minutes to be able to address any questions that come up, and then from there, they'll probably have to leave in order to address other upcoming issues. I can make sure that if there's other questions that come up after the first 15-minute period, that I communicate those with those two individuals ahead of time so that they've got enough lag time to response. Okay, question from Dr. Hagerman here. Many districts have upcoming board meetings about reopening plans. That last document would be very helpful for those discussions. Yeah, I agree, and that's why we're drafting it. I do need to make sure that I get the appropriate research established in there. There's a lot of information related to COVID, a lot of new, fresh information. You know, I've already plowed through at least, I think it was the 70 plus research articles trying to gather as much information, and some of it is conflicting. We are working on an updated evaluation tool internally for our data that we're tracking with cases, so that we can pull and plug data analysis really quickly. We started a little bit behind the bus there, so when we have that tool, I think it's going to be a lot easier to pull up a lot of these graphs. We won't have to do as much manual data entry and manual analysis on the numbers in terms of the caseload. One of the big things that we could really use, and if you as a district have this information gathered, is a qualitative analysis on exposure specifically for teachers. Because what we're finding overall, and we don't have the ability to capture all of this data, is that with teachers, the primary method of exposure has been social gatherings or home transmission. There's been very little student to teacher transmission. Teacher to teacher transmission has occurred, but it's been in settings like lunchrooms or at staff interactions inside and outside of school. So if you have that information handy and you have raw numbers and some raw data that we can use in some analysis, that would be really, really helpful. So just reach out to me via email. I'll connect with you in order to gather that data. We would definitely be citing that and potentially even passing some of that off to the CDC. So just be prepared to not receive those questions, but to have that kind of scope upon that data. Okay. Question from Ms. Koleski. Do you see a near future where students will be offered the vaccine? Parents will be asking. I cannot comment on that at this point in time. Crystal or Kristen, do you have any comments on that?
This is Crystal. I think that it's going to be a while before we see it widely offered to students because it's not approved for children at this point. The Pfizer vaccine is approved for ages 16 and up, so there will probably be some limited application there, although most of them won't fall into those higher priority groups for some time. But we're hoping that as they expand testing, we'll be able to see safety and efficacy in children. And so hopefully we should start to see some rollout in kids. We just really don't have any kind of timeline on that right now.
So Tiffany just came by and said, I think you were muted during that, which I then checked my microphone and saw that that was true. I was indeed muted. So let me cover this one more time. You can see here that this is a general timeline of phase 1, phase 2, and phase 3. For 1B, note that the EMS and law enforcement will be the first allotted group in 1B, and then the rest of 1B will follow subsequently after that. So that's an additional criteria. Age 75 and older is also included in the 1B as well. Okay, well, I'm going to stop recording at this point in time.